Choosing to have your knee or hip replaced is one of the biggest medical decisions you'll ever make, and there's a lot to take in before surgery. As a surgeon, I'll be the first to admit that we could often do a better job at giving patients all the information they need in order to ensure a smooth recovery. But the last thing you want to do is put yourself at risk of developing complications or a poorly functioning joint just because you didn't get all the information you should have. The questions you ask before surgery can absolutely make the difference between being happy with your outcome and regretting the decision to have surgery in the first place. In this video, I'll share what I think are 4 essential and often overlooked questions that every patient should ask their surgeon before joint replacement. Hi, I'm Dr. George Bounajem, Dr. B for short, and I'm a board-certified orthopedic surgeon. After residency, I completed fellowship training at Harvard Medical School specifically for hip and knee replacements. Joint replacements are the core of my career, and I can tell you that patients who ask the right questions before surgery maximize their chance of a good outcome. The first question you should ask is about your surgeon's experience. Specifically, how many joint replacements have they performed? Now, this is something that patients can feel uncomfortable asking, but I think it's a perfectly legitimate question to ask. It isn't rude or questioning their qualifications. It's a matter of understanding what level of expertise you're getting. After all, it's your body, and you have a right to know who's operating on it. Joint replacements have a learning curve, and different surgeons can have very different levels of experience. Studies have consistently shown that surgeons who perform more joint replacements have lower complication rates and better outcomes on average. Just like people who practice any other craft, we are better at the things that we do frequently. A related bonus question is, do you have any special training in joint replacements like fellowship training? A fellowship is typically an extra year or more of training after residency with a special focus on a specific area of orthopedics. Many surgeons like myself choose to undergo that extra training to excel in a particular subspecialty. So you've confirmed your surgeon has the right experience. But the reality is that your actions before and after surgery also have a huge impact on your outcome. This leads to the next crucial question. What can I do as a patient to increase my chance of a good outcome? I absolutely love when patients ask me this question. It signals to me that they are active participants in their own care. Think of it this way. Surgery is a team effort. Yes, your surgeon, anesthesia team, operating room staff, clinic staff, and physical therapist are all part of this team, but you are a key player as well. Your outcome doesn't just depend on your surgeon's skill. It heavily depends on what you do before and after surgery. Depending on your medical history and other circumstances, we often have specific recommendations to prepare you for surgery, as well as specific advice for your recovery. We might talk about stopping nicotine use, managing certain health conditions like diabetes, or stopping certain medications for a specific period of time. Since every patient is different, your surgeon may have advice that pertains just to you and is not necessarily applicable to everyone. So we've talked about what impact both you and your surgeon have, but even when we do everything possible to control the outcome, problems can still happen. Like with any surgery, there is a chance of complications. It's important to always ask, what are the risks of surgery? Even if the chances are low, you have a right to understand what could go wrong. More importantly, understanding the risks helps you make an informed decision about surgery, helps you identify the warning signs, and reduces the chance that complications occur. The good news is that the risk of major complications after joint replacement is relatively low. Serious complications like infection, blood clots, or mechanical issues with the implant generally occur less than 5% of the time. However, factors like your medical history, your anatomy, or prior surgery can increase your risk of complications. This segues into the last question that you should ask, and it's one that many patients don't think of. What makes me different from the typical joint replacement patient? Like I've said many times on this channel, no two patients are exactly alike. Your age, health conditions, activity levels, and goals all affect your risks and likelihood of satisfaction after surgery. Generic advice cannot account for your specific situation, so understanding how you're different can be extremely crucial. For example, if you're younger than most people who have a joint replacement, you might need additional surgery on that joint in your lifetime. If you're out of shape, your capabilities after surgery are likely different than someone who isn't. Medical conditions like diabetes, heart disease, or arthritis in other joints can affect your risks and recovery. There are countless examples of how specific situations can affect surgery, and you may not know until you ask. To recap, these 4 questions will give you a clear picture of your surgeon's experience, how to optimize your outcome, what could go wrong, And what makes your situation unique? This is by no means a comprehensive list of what you should ask, but I think it's a great start for anyone who's considering surgery. Remember, you are an active participant of your own healthcare team, and asking the right questions is the first step to improving your health. If you're considering a joint replacement and you're interested in one of the most common mistakes that I see patients make, I'll link my video on that topic right here. It's specifically targeted at knee replacements, but to be honest, it's true for hip replacements as well. If you found this video to be helpful, click the like button so I know to keep making videos like this one, and leave me a comment down below on what I should cover in the future. Stay well, and I'll see you in the next video.